there, my name is Stephanie. I am a third-year nursing student, and I'm going to demonstrate how to reconstitute a medication and then administer it via the CIVA. So I've already pulled up my medication, which is my methylprednisolone, and I just want to check my medication against my MAR. I'm also going to check it against the parental drug monograph and then my CIVA instructions. So my first med check here, I'm pulling up the methylprednisolone for my patient, Ms. Britney Spears. She has arthritis, and this is a really great anti-inflammatory medication. Her order dose is 100 milligrams, so I've pulled up the 125 milligram vial. It's to be administered IV via the CIVA. It's a Q6H medication, and right now she's due for her 0900 administration. I'm going to note that my patient has no known allergies, and I'm just going to check the expiration date on my vial to ensure that it has not expired, and it has not.
And to do that, we need to look at the drug monograph, and that will let us know how we're
So, methylprednisolone, a 125 milligram vial, needs to be diluted in sterile water to 2 milliliters. So the final volume is also 2 milliliters. And at this time, I'm also going to note any potential hazards or side effects. So the main one is cardiovascular collapse. So I'm going to monitor for tachycardia after the drug is administered. And I'm also going to monitor for some generalized signs and symptoms or side effects such as nausea or any flushing. The other thing I'm going to want to do is educate my patient about corticosteroids. Methylprednisolone being a corticosteroid, it is immunosuppressive. So the importance of hand hygiene and staying away from anyone who's acutely ill with a cold or a flu is very important. And I'm just going to check my CIVA instructions. Okay, so I see methylprednisolone is going to be administered at a normal pump setting. It's approximately 26 minutes, and it is to be further diluted in normal saline to 10 milliliters. So I'm just going to do the math for that right now.
swap the top of our medication vials.
So if I require 100 milligrams and I have 125 milligrams, I know to divide the 100 by 125, and then I'm going to multiply that by the diluent volume, which is 2 milliliters, and that gives me 1.6 milliliters that I need to administer for the medication. If I need to ensure a total volume of 10 milliliters, then I know that I now need to add 8.4 milliliters of normal saline to ensure that I have a total of 10.
So I'm going to be taking blood tip here.
Okay, so I'm going to begin drawing up my medication. Now I'm going to be using a 10 milliliter syringe for the entirety of pulling up the medication as well as the normal saline. I acknowledge that I have to be quite careful when I'm pulling up my normal saline, as I don't want to lose any of the medication and then have an incorrect concentration. So first thing I'm going to do is pull up 2 milliliters of sterile water for reconstitution. And I'm going to swap this for 30 seconds, and then I'm going to let it dry for 15. I'm going to inject my air and pull up my 2 milliliters. So I have 2 milliliters of sterile water. I'm just going to recap for safety here and for sterility. And I'm just going to do my second med check before I reconstitute. So my medication, methylprednisolone for Ms. Britney Spears, 100 milligrams, perfect, for the IV via the CIVA for her 0900 medication.
Perfect. So now that I have all my air bubbles out, I'm going to measure it.
And I'm just going to swab the vial here, swabbing for 30 seconds, and then letting it dry for about 15.
Just temporarily recap it, and I'm ready So we have our 6.8 ml.
Now, because this is a powdered medication, when I reconstitute it, I don't want to shake it. I don't want to introduce any bubbles into the medication. So I'm just going to roll it between my hands until all the medication is dissolved into the liquid.
Make sure if I did have a mistake.
Okay, that looks great. The medication is dissolved. And at this time, I'm going to pull up my 1.6 milliliters of my medication. Again, swabbing for 30 and letting it dry for about 15. So I pulled up about 1.6 mLs of air.
The air should displace in time. I'm going to dispose of any of my garbage as well as put any trash in the garbage. Okay, so safety, we're going to wash my hands. Okay, so I'm just going to roll my medication to reconstitute it. Basically, you're looking for when you cannot see any particles anymore. It's just completely one solution. And now we're ready to work.
Okay. So I've pulled up 1.6 milliliters of my medication and ensured that there's no air bubbles in there.
Figure out how much medication you actually want to be giving.
So now what I want to do is pull up the rest of my normal saline to ensure that I have that 10 milliliter volume. So I'm going to swab my vial for 30 seconds and letting it dry.
There's no redness or irritation.
Then I'm going to pull up some air to inject into my vial. And I'm going to inject upside down so that I don't lose any of that medication.
So, some is one of the antibiotics that you order just to help with the infection on your right leg. So it's going to help to clear that up.
And pulling back my saline.
Just going to with this medication, just the common side effects. When I was rolling it, I don't know if my fingers touched it or not. If you experience any of those symptoms, please don't hesitate to let me know, and I'll come back to the room and help you with that. So at this point, I've given the patient the right medication, the right reason, so I told them what he's getting the medication for, as well as the right person.
Perfect. So I'm really happy with that. I have my 10 milliliters now.
Pull out my secondary.
And I'm going to write my medication label.
Before doing anything else, do my third bar check.
So I'm going to write my patient's name, the drug, which is my methylprednisolone. My dose is 100 milligrams. October 18th at 0900. The sign. Perfect. So I have my medication label filled out. And I'm going to prepare my tubing. So I'm just going to inspect my tubing, make sure that there isn't any holes or anything like that. The tubing looks great. And I'm being very cautious of maintaining sterility as I attach my medication to the tubing.
Because my patient has so I don't want to give too much fluid.
I'm going to prime my line.
And I'm going to give it over 30 minutes just because my patient really needs these antibiotics quickly. So
And it is primed. And I just want to now put a label on my tubing. So I'm going to put the date, the time, and my initials.
But checking the expiration date on my drug as well. And I know here that it is good, so that is something you would want to do well. Just to make sure that your medication, that's how you know. So I'm checking the expiration date, making sure that my
So I'm all ready to go. Everything's sterile. I still have all my caps on. I'm going to take a couple of alcohol swabs, and I'm going to bring my MAR with me.
Lower than the piggyback, and that ensures that the medication is close through the IV to ensure that he gets.
So as I'm walking into my patient's room, I'm going to do a quick safety check, make sure everything looks good, checking the bed. And hi there, Ms. Spears. My name is Stephanie. I'm the student nurse who's going to be administering your medication today. How are you feeling?
My signature so that my coworkers know who hung up the two.
So I brought you your methylprednisolone. This is an anti-inflammatory medication for your arthritis, okay?
So the amount of medication.
Can you just tell me your name and date of birth, please?
The total volume is 107.9 milliliters. Okay, perfect.
I just want to check your IV site here before we get into administering the medication. Are you experiencing any pain? Good. Okay, the site looks great. I'm really happy with that. I don't see any occlusions in your primary line, so that's great. And so I'm going to do my third medication check right now.
The IV is running smoothly. I'm going to double check all the locks are unlocked.
So,
I have my medication here.
we are going to be administering methylprednisolone to Ms. Brittany Spears. Her order dose is 100 milligrams via IV CIVA. This is her 0900 hour dose.
Any of the side effects, please don't hesitate to call me. I can come help you with that. I will also be back in under an hour to come check up and make sure.
Now I'm going to use a port lower down as I don't want it to be regulated by the Baxter. And I'm going to be swabbing that for about 30 seconds and then letting that dry. Maintaining sterility, I'm going to be really careful not to touch that port as well as the one from my tubing. So that's all good. Don't have any kinks.
That is everything. We're going to enter the patient's room now.
Now this medication is to be administered over 26 minutes, and that looks just about right where I have that on my CIVA, so I'm happy with that. And I know that I'm going to be setting this at a normal speed. Okay, Mrs. Spears, now this medication can sometimes make you feel a little bit flush or a little nauseous, so let me know if you experience any of that. Also, if you feel like your heart's beating really quickly, make sure you call myself or another nurse over right away, okay? Because that can be a side effect. Also, have you taken this medication before or any other type of corticosteroid? Okay, so corticosteroids are immunosuppressing, which means that they can make you more vulnerable to infection. So I really want to stress the importance of frequent hand washing, as well as making sure that if you're around anyone who's sick, they know to cover their cough and maintain a good safe distance. I'm just going to stay here for a couple of minutes and just make sure that the medication goes in okay. How's it feeling? Good. Okay. Now I'm going to document in my medication administration record that I have given the medication at 0900, 0905, and I'm going to sign off.
So now what I'm going to be doing
and I
is setting up my line here.
would come back in about 24-25 minutes just to evaluate how that medication went. I mean, essentially, I'd like to come back after a couple of minutes just to make sure everything's okay. Then I'm going to come back at the end so that I can flush my line. So this line is quite small. I really only need about 3 milliliters of normal saline to flush, so I would come back with that. I would flush my line to ensure that all the medication has been administered, and then I would be good. I would document if there was any concerns with the site or if there was any concerns with the medication, and I would document that in my IPN.